All right, good morning, everyone, and welcome to our next installment now with digestion, specifically to do with acid reflux and GERD, gastroesophageal reflux disease. And so this really is a common thing happening with at least 1 in 5, it says statistically, but I'm pretty sure there's more than that, of people who do experience symptoms of acid reflux and GERD. And it's probably more so on one of the more common symptoms and complaints now, seeing a medical doctor, with other complaints being fatigue, tiredness, and so forth. So, in this talk, and we're going to have some fun with this, we're going to talk about what really is acid reflux. We're going to talk about what it really is and what is really occurring. How does it evolve to what we start seeing as those kind of classical symptoms of acid reflux that we're going to talk about? We're going to touch base a bit about the usage of proton pump inhibitors, one of the most common medications. We call them PPIs for short, but these are one of the most common medications prescribed specifically for acid reflux and for GERD. And right now, it's probably one of the most commonly prescribed medications on the market too. And we're going to finish it off with how we can really start reducing some of the symptoms, because this tends to be, we call it chronic, and a lot has to do with our lifestyle and such. And before we can even start thinking about treating acid reflux, we need to identify what we're doing to cause it so that we know how to approach it rather than looking for, the quick fix. Again, this is meant to be medical, just information and advice. It's not intended to replace medical advice or medical impressions, or meant to be relied to treat, cure, or prevent any of the diseases, illnesses, or medical conditions mentioned in this talk. The attendance does not establish the patient-doctor relationship. If you do have any of these and that you'd like to have them addressed, I suggest that you bring that forth to a medical doctor, nurse practitioner, or a physician. My name is Dr. Romi Fung, and I am a practicing naturopathic physician here in Richmond. I did my naturopathic medical training at the Canadian College of Naturopathic Medicine in Toronto, and prior to that did my pre-medical training in health sciences at Simon Fraser University. And I'm currently on my reading break right now for my master's in aging and health, which is quite interesting. I think this was probably the first weekend I've had where I'm wondering to myself, what am I supposed to be doing right now? But I am excited to share that I'll be completing this program in the next 4 weeks, and I'll be embarking on a PhD in aging and health happening later on in late August, early September. But working and practicing as a naturopathic physician, I've had my fair share of seeing patients with acid reflux. And I can share my firsthand experience that, one, it is a lifestyle condition where it's really about identifying, first and foremost, what may be problematic, what may be contributing to the reflux itself. Because if you continue to have those behaviors that correlate with the acid reflux, even if we did start with medications which do share and do show that they're very helpful, it's a matter of getting into the root cause. And that's my role as a primary care naturopathic physician, and understanding what's going on, not just within the body. I mean, what we learn in a lot of our talks is really happening in the biochemical level, understanding what proteins are involved, what enzymes, etc. All that is really interesting, but it isn't until I really understand how your lifestyle is as the patient. And you, as the patient, who owns your lifestyle, is the expert. So really sharing with me your story and what you do on a daily basis, we get to combine the best of both worlds. And then we start to understand how we can really approach this. And that's what I believe in terms of medicine. So with that being said, let's get started here. A common misconception happens first with this question. Do you believe acid reflux is high acid or low acid? Now, here's the thing. It can be both. And in most cases, and what I'm going to be talking about, is that acid reflux is actually low acid. Now, the common kind of thought here is then, but if you have low acid, how is that acid getting up into the esophagus? And wouldn't it make more sense that because you have too much acid, that it overflows up? And that actually does make sense, at least in terms of the physiology. But first off, we have to understand what really is acid reflux. So acid reflux comes in many forms or many symptoms, including heartburn. And then the other way to describe it is GERD, gastroesophageal reflux disease. And that really is where stomach acid is regurgitating up. So here we have the stomach right here, where we produce the stomach acid, and that's where stomach acid is being regurgitated up into the esophagus. That's the tube that leads from the mouth to the stomach. And having this kind of acid coming up here, there's not really much protection going on in the esophagus. And that could potentially erode and damage your esophagus over time, leading to various conditions such as something called Barrett's esophagitis or even esophageal cancer. Stomach acid should stay in the stomach because the stomach is well protected, and that's where the site of digestion, at least first off for protein, happens. Now, conventionally, medical treatment for acid reflux involves neutralizing our stomach acid. And this is where some of the things, especially with the medical field as well as the patient population, would think, well, if they're treating me by neutralizing stomach acid, wouldn't that mean I have too much stomach acid? And so some of these medications tend to be either prescription or even over the counter now. There's certain medications such as calcium carbonate in the form of Tums that also have this, or even prescription medications such as PPIs, proton pump inhibitors. And these will effectively bring down the stomach acid and thus relieve the symptoms. Because if you're reducing stomach acid, then it would kind of like almost shrink down back into the stomach. But that doesn't really address the underlying cause. Why is this happening in the first place? And then long-term use of proton pump inhibitors can also lead to a varying array of conditions, such as osteoporosis, increased risk of infection, and reduced absorption of certain nutrients. So we really do need this intricacy of this balance of stomach acid. But stomach acid is kind of like almost I guess you could say like a double-edged sword. It's really, really challenging to control because stomach acid is also quite, I mean, as it states, stomach acid, it's acidic. But how acidic is stomach acid? And this is where I actually ask my audience, how strong do you think stomach acid is? And does anyone even know pH and what the pH of stomach acid is? But because we're on an electronic format right here, you're just going to have to be surprised. But everyone knows the pH of water, and that is neutral at approximately 7. But what is the pH of stomach acid? pH of stomach acid is about 2 to 3. So on the pH scale, that's about, 4 to 5 below 7. But what does that mean in terms of relative strength? In order to go down or up by 1 on the pH scale, you have to be 10 times stronger. So if you go up the pH scale, meaning going from pH of 7 to 8, making it more basic or alkaline, it has to be 10 times more alkalinic in order to become, of water at 7 to become 8. So, or we had to find something that's more acidic and by 10 times to become 6 from 7. So if it's 10 times per numerical, how many times more acidic is stomach acid compared to water? Think about that for a moment. From 7 to 6 is 10 times. 6 to 5, another 10 times. In other words, 100 times. Okay, 7 to 6, 6 to 5, 5 to 4, 4 to 3, and 3 to 2. Let's just say, so that's about 5. So that's 10 to the power of 5. So that's about 100,000 times acidic than water. That's a big jump, and that is really acidic. In fact, you can actually go up onto YouTube and you could probably find videos where people take and isolate stomach acid and they put one of those small razor blades in a beaker with stomach acid. And stomach acid can actually dissolve a razor blade. So think about this as we're trying to balance things and keep things working at their correct locations and their correct functions. So when we think about acid reflux, we think about an array of symptoms. First and foremost, a lot of people would start seeing symptoms of bloating, belching, and even that burning sensation, what we call heartburn. And that's because the esophagus and the sphincter that opens up, the opening of the stomach up from the esophagus is really close to the heart and the chest area. And so that's why we kind of consider that what we call heartburn. And that's what happens when food's not really digested that well and gas also starts to form, leading to that bloating and belching. And then, as you may have already kind of connected the dots with the previous talk, we talked a bit about SIBO previously a couple weeks ago. And it's about not killing off the proper bacteria that would then ferment the foods, leading to gas production and thus bloating. So is this really some connection right here? It's potential. Feeling particularly full after eating, especially if you're not digesting foods very well, you're going to have undigested foods going through you, and that could actually be more bigger in size. That could potentially signal the body that there's more than what you need, leading to that particularly full feeling after eating. Sensations of indigestion. If you're not having enough or optimal levels of stomach acid, the first thing that gets digested in the stomach that requires stomach acid is protein. And if you're not digesting protein, or you have difficulties digesting protein, then stomach acid may be something that you have to look into. Talked a bit about heartburn, bloating, the burning sensation after eating. Now, diarrhea and constipation, especially if you're not digesting foods well enough, that you might not be killing off the bacteria leading to food poisoning, for example. But also, as we talked about with SIBO, if you leave the opportunity for certain bacteria to thrive, especially in the small intestine, fermenting your foods that you're eating and producing methane gas, that could lead to constipation, or hydrogen gas leading to diarrhea. It could also have contributions to food intolerances, and we're going to talk a bit about that in a bit. But other symptoms such as nausea, weak peeling and cracking nails as a sign of suboptimal stomach acid. Now, not just nails, but there has been some correlations with hair loss or even weak hair, potentially to do with deficiency in B vitamins. You do need certain B vitamins does require to be absorbed through stomach acid or with the support of stomach acid, the big one being vitamin B12. Because stomach acid activates something called intrinsic factor. And it's intrinsic factor that then breaks the bond. It's kind of like it chops vitamin B12 off of the protein source that you've consumed, and then that allows your body to absorb it. If it's not chopped off, your body's not going to be able to absorb B12. This is where some people who may be B12 deficient, even though they're not vegetarian or vegan, it could be something to investigate in regards to stomach acid. Another one is iron. And a lot of women, especially who are still menstruating, may complain of iron deficiency, or what we call anemia. And that could be that the body is just not priming the digestive tract because there's a suboptimal level of stomach acid that could then not fully absorb iron. And iron's really harsh to absorb in the first place too. If you've ever taken an iron supplement, you might actually sense that constipation going on because it's quite harsh. So looking at it, what is really happening? Looking at the left side here, you see the stomach and you see the esophagus. And there's something called the lower esophageal sphincter, or in other terms, the cardiac sphincter, because it's the closest to the heart. And it's the sphincter, LES, that has to work well to keep the stomach acid in, so that the stomach can fully utilize that acid to churn, digest proteins, and other things. And if it doesn't do its job, well, this is where you get that influx or outflow of the stomach acid. So if you have an abnormal functional valve and it doesn't close properly, well, chances are stomach acid, as the stomach starts churning, can actually flow up. So is it really a matter of high stomach acid in this case? It could still happen with low. And since we talked a bit about the pH of hydrochloric acid, we know how acidic it is, but we also need to find out, why do we need it in the first place? Because it's not really, it comes to a point where when we start talking about stomach acid, and with acid reflux, we start victimizing stomach acid because it's really burning our esophagus. I chose to do this slide right here to give us a better sense of why we need stomach acid in the first place, because it's not really all that bad. It just happens to be, just like with SIBO and how we have good bacteria, but it's in the wrong place. Same thing applies with hydrochloric acid. We need hydrochloric acid to break down proteins into smaller molecules. So protein is a fairly big molecule or kind of group of cells that we need to further break down so that when it hits the small intestine, it can be broken down even more. Because it's so, can't even think of the term right now, but breaking them down properly so that we can absorb them properly. Because if we don't absorb the protein properly, it's going to stay in our stool, and that leads to undigested food. But it also, we need hydrochloric acid for our stomach to empty properly. So hydrochloric acid isn't just acid sitting in a vessel. It actually, our body is constantly getting feedback from the stomach and from the other organs in our digestive tract to really find out and understand where our digestion is at. So if you don't have enough, or you have a suboptimal amount of stomach acid, well, the body's going to see that as you're not digesting, but it's not ready to digest in the first place. It's almost like trying to find out, and I'm going to just use a random analogy here that I use, and for some people it might work, but we need a specific amount of food to enter the stomach to then start the digestion. So if we have too little, then it's not going to want to ramp things up. It's almost like as if you own an amusement park and you have a roller coaster, and you have 20 seats on this roller coaster, and you want to make the most amount of money per round. Would you want to send off the roller coaster with one person on, or more about 15 to 18 people on there? Of course, you want more the merrier. Almost in relation to that, the stomach is kind of like that. If you don't have enough stomach acid because there's not enough food stimulating the production of stomach acid, or that your production of stomach acid is modified, then it's not going to want to close up. And if it doesn't close up, well, things are going to be able to leave out. That's kind of the idea of the stomach acid moving up into the esophagus. Because it's so acidic, the stomach acid actually acts as one of the first lines of defense against pathogens in the digestive tract. Not only as a line of defense against pathogens, it also helps with maintaining the levels of H. pylori. Now, you probably have, for those of you who have acid reflux symptoms, you were probably asked by your doctor to get a H. pylori breath test done. And H. pylori actually lives in all of us. It's not pathogenic until it grows too much. And how does it maintain, or how do we actually maintain and balance its levels? That's through stomach acid. So if you don't have enough stomach acid, it's going to not be able to keep the H. pylori in check. And chances are your tests are going to be positive with H. pylori, because there's just an overgrowth of H. pylori. And H. pylori can then bind into areas of the stomach, leading to stomach ulcers and such. So again, it's almost counterintuitive, because you think, but I thought too much acid would then cause the ulcers. Well, any amount of acid can cause any ulcer, but it's a matter of keeping the cells and the barriers in check in the stomach. And H. pylori can actually infiltrate that. Your stomach needs a specific pH to absorb certain nutrients. We talked a bit about vitamin B12 and how you do need a specific strength of acid, stomach acid, to then break apart the intrinsic factor to then absorb B12. It's also a signal. that if you have a good amount of stomach acid, then your food is going to be properly digested, going into the small intestine, and then the downstream of messages will be quite smooth. So if you're not digesting anything well in the first step of things, what are the chances that everything else will follow suit from there? And this just goes back to the line of defense against pathogens to prevent disease by killing pathogenic bacteria and yeast present in food, and also keeping in check with H. pylori. So what really is causing this to happen? Because our stomach acid just doesn't change overnight, whether that be the strength or the amount. At the same time, um, to my knowledge at least, and I welcome any evidence. I'm going to look at this up again, but to my knowledge, it's really not all that common to have high stomach acid unless you have some sort of tumor that is producing stomach acid. Now, why do I say this? Well, with older studies, it showed that about only 5%, 5 to 10% of acid reflux cases is to do with high stomach acid. So I'll never refute that if the results and if the signs and symptoms are showing that it's high stomach acid. But it's actually becoming more commonplace that it's low stomach acid. First and foremost, because of stress. Now, I use the same analogy for stress a lot, and that is, if you have a tiger that's just magically appeared in the room, what would you want to do? You'd want to run. You want to run away, avoid it at all costs, unless if you're the very courageous and you would fight it. But this response is what we call our fight or flight response. And that happens to be under the sympathetic tone of our nervous system. But in order to ramp up the fight or flight in us, we need to ramp up certain hormones, one of them being cortisol. And cortisol then, as a catabolic hormone, breaks down our storage to get more sugar going into the blood so that we utilize it, or our muscles utilize it, so that we can run away or fight it. And then our breathing gets deeper and faster so that we actually get more of the oxygen going in. And so forth. We stop sweating. But when you're fleeing or fighting, when you're in sympathetic tone, you turn off the parasympathetic. And that is a rest and digest tone. So what that means is, in order to fight this, we need to turn off a lot of our regular resting, digesting processes. So there are a lot of people out there that have been, that either stress eat or that eat while they're working or they're stressed, etc. And it's common to hear people saying, well, I've had bouts of indigestion, or I didn't feel like that really went down quite well, etc. And that's because your body is not primed to digest when you're stressed. When you're stressed, your body wants you to survive. And though that sounds counterintuitive, it wants you to survive by fleeing whatever is the threat that you're perceiving. But the body doesn't know what the threat is. It's your brain that does. And if your brain is tricking your body into saying that there's that tiger that's just sitting next to you, when in fact it's just, a lousy coworker, or that you have just a really huge workload, the body doesn't quite know that. And thus it's going to want to just continually prime you to fleeing or fighting whatever threat that is. because we're made to flee and fight predators as animals. So stress is a major part of kind of shutting down. Shutting down is maybe not the best word, but to bring down the activity of the digestive tract so that your body can reallocate that energy to then address whatever threat is going on. And when we stress eat, well, we choose foods that may not be the best wholesome sources of nutrients, because certain minerals and certain nutrients are needed for the production of hydrochloric acid. We also know that too much sugar or too much saturated fats can actually affect the sphincter that keeps the opener closed into the stomach. We also need certain minerals to optimize the level of hydrochloric acid, some of them being magnesium for one, and I believe zinc, and many others. Having a history of smoking contributes to gastroesophageal reflux disease by relaxing that esophageal sphincter, that LES, or the cardiac sphincter. And thus, if it relaxes that sphincter, it's going to stay open for longer. So that's something to think about when it comes to smoking, but also certain medications as well. This is actually a chicken or the egg kind of thing. H. pylori infection can contribute to stomach acid, but if you don't have optimal stomach acid, you can't then control the H. pylori infection. And well, I should have just connected all of this. Smoking, medications, alcohol, caffeine can all relax the lower esophageal sphincter. So controlling your consumption of alcohol, caffeine, and for some people, caffeine can also be coming from chocolate. And some people find that chocolate can irritate the acid reflux symptoms. And that's because the caffeine content in there can relax the lower esophageal sphincter. And a low protein, high carbohydrate diet can really contribute to that relaxing of the sphincter. But at the same time, there's some studies that show that low protein, high carbohydrate can potentially also mean higher fat, and higher fat can lead to some symptoms of acid reflux. But also may not be just higher fat, but low fiber. And maybe fiber is that big part to contributing to acid reflux. There's some studies out there that show that groups who do have a higher fiber intake share less symptoms of acid reflux and heartburn. Well, what would happen if this continued on and you left it untreated or controlled in regards to taking Tums, Pepto-Bismol, or Pepto-Bismol, or PPIs? Well, the long-term acid reflux can damage your esophagus, and that could lead to Barrett's esophagitis and potentially esophageal cancer. If left uncontrolled, it could really change the structure of the esophagus, leading to strictures, which are kind of pockets and openings that lead to bacterial growth that just stays in there. And that could actually fester and manifest in other ways, and potentially, again, esophageal cancer. If you don't have proper stomach acid pH, that can lead to nutritional deficiencies such as B12, magnesium, and iron. And if you don't have enough B12, well, that's going to lead to fatigue, anemia, and um, a lot of other things. B12 can also be good for the nerves, nerve health, and potentially what part of the body has the most amount of nerves? The brain. So B12 deficiency as a result of improper stomach acid can lead to and contribute to symptoms of dementia. Because I work with dementia patients, that's something that I have to also investigate too. Why are certain nutrients um, low or high? This is where we have to work as a detective in this case. But if you are also using proton pump inhibitors, whether that be pantoprazole, omeprazole, and so forth, and that could lead to side effects and adverse effects due to long-term use, including osteoporosis, um, kidney damage. We talked about nutrition and absorption of vitamins and minerals, and also dementia. And so these are things that you think, wow, I never thought that stomach acid can really contribute to, different parts of the body, including the brain. Well, this is where you really have to start understanding that the body works holistically. If your digestive tract is not working well, chances are you're not absorbing certain nutrients well. And every part of our body and system, every system requires certain nutrients for them to function. So it's almost as if, as we talked about in our first, I think I brought this up in one of our first digestive lectures, that the father of modern medicine, Hippocrates, states that all disease begins in the gut. And that actually starts to make sense now when you bring this element in. It's not that infections in the gut can lead to disease in the body. It's that if the gut is not functioning properly, that could contribute to the various diseases going on in the body. So I'm probably scaring you too much, but what can I do now in this case? And there's a few things to start. Of course, we have to really identify our lifestyle and our behaviors, and there's quite a few things to consider and that we talked about in terms of optimizing the body's processes through certain behaviors. I think in one of the first lectures to do with sleep, we talked about cycles and how specific times of the 24-hour cycle contributes to a specific part of the body that works well. So I think we talked a bit about the TCM clock and how the liver works or is working at its most optimal between the hours of 1 and 3 in the morning. Well, certain organs will have that kind of functionality at different times of the day. There's no kind of, though evidence is still minimal, but it doesn't make sense to me to think that our stomach and our intestine is kind of like, one of those coal pits where you throw coal and it just flames up over time. Our bodies are not always going to be digesting 24/7 for us. There are times where it has to, slow down on the digestion in the case of stress, but also in the case of sleep and times where your body needs to start regenerating other components. In fact, I think back with the cycle lecture, we talked, or I might have pointed out that your bowels actually work best, or you might have a bowel movement that tells you that you're optimal when you do have it between the hours of 7 and 9 in the morning. And that means that you're defecating or you're going to the bathroom at that time on a more regular basis, because that's a time when the body works well and in excreting and defecating. So this has elements of the circadian rhythm as well as the TCM cycle. First and foremost, a lot of us tend to feel sleepy after a meal, and there's a lot of us that would take that afternoon or post-dinner kind of nap lying down or so forth. But by lying down when after eating, your body senses that there's going to be a lot of food going into the stomach and in the small intestine, and then that leads to wanting to ramp up the production of hydrochloric acid so that it can really start digesting the foods that you're eating. Well, if you don't stay upright, and if you do have that relaxing of the lower esophageal sphincter, that could lead to the stomach acid actually just pouring into the esophagus, especially if you're lying down. So if you're going to have to nap, find a wall and nap while you're sitting up, but stay upright while you're eating. We kind of touched base on food sensitivities, but keeping a food diary and trying to figure out what foods may actually contribute to your acid reflux can be quite beneficial, because it's the stomach acid that potentially, not the stomach acid, but when you do have food sensitivities, that leads to a lower grade of inflammation that's going into the digestive tract. And that low grade inflammation can affect your digestive system. And that could lead to a few things. One of them is the relaxing of the lower esophageal sphincter, but it can also irritate certain parts of the stomach. And that could also be confused as reflux. So taking out the food sensitivities, as I had with my patients, was also quite helpful in controlling their acid reflux symptoms. If you are a smoker, it might be something to start considering about reducing the amount of cigarettes smoked, or even changing the schedule of your smoking if you have to. Now, I'm the one that ideally would like people to be off the cigarettes, but of course, cutting cold turkey can also be quite challenging as it is. So working our way down to that and finding ways to go around it would be my first step of action. Diaphragmatic breathing. Now, there's quite a bit of evidence where breathing through the stomach before, maybe not after, but shortly after eating can really elicit the parasympathetic response. And we know that the parasympathetic is a rest and digest. When we start getting into a stressed mode, our breathing tends to become very shallow. And that puts us even more into that stressed response. So even diaphragmatic breathing is one thing before having dinner. Mindfulness and mindful eating can also be a part of this diaphragmatic breathing. So what do I mean by mindful eating and mindfulness? In this case, with eating. And that's actually getting to really savor the experience, because that is also a contributory to happiness for those of you that, as of last week, who tried the happiness course taught by Laurie Santos in Yale University. One of the methods that really bring up the hedonic adaptation is to savor and to be in the moment, to be present. And so how do you do that in terms of eating? Well, first off, understand and smell the foods that you're having. Really enjoying the smells, closing your eyes if you have to. Some cases even what they call masticating or chewing your food properly. and really giving your body the signals that you are eating. Because in this kind of society right now, chances are you're probably swallowing food within 1 to 2 bites. And if you've ever seen any of those food eating competitions, I fear for those people who are just swallowing their food without chewing. And then there's a few studies out there in terms of fiber intake and GERD. And that could potentially be that fiber helps things move along the track. And that is also a really big signal for your body, especially when it regards to the proper functioning of the digestive tract, but also helps with the good gut bacteria that requires fiber as food. There are also a lot of foods out there that will likely trigger, we call them trigger foods, that will likely relax the lower esophageal sphincter. And so the American Society for Gastrointestinal Endoscopy has created this, where there's certain foods that may contribute to relaxing of that sphincter, leading to the regurgitation of acid. So some of these foods can be coffee, citrus fruits, and even tomatoes. Carbonated beverages, chocolate, and caffeine. Peppermint is a big one. Peppermint is used to relax the lower esophageal sphincter, which can cause acid reflux. And even any foods that have to do with a lot of fats added, whether that be fatty or fried. So these are foods to think about and to monitor, especially if you have acid reflux symptoms. And something that you want to do is to keep a food diary, because not all of us will have the same triggers, but these are more common triggers. And other triggers would be coming from food sensitivities. Especially when you come work with, no, sorry, I'm getting a few messages here. Just making sure that my sound is okay. Okay, it's not my sound. Working with a naturopathic doctor like myself, we look into many things. One of them is the food sensitivity test. And that really shows us what foods your body's actually reacting to. And that way we can reduce the burden of the body by reducing or taking out the foods and allowing the body to recuperate first and foremost. And most common foods that are high or ranked high in the food sensitivities would include eggs, milk and dairy, wheat, and gluten, but also corn. We learned a couple of weeks ago that SIBO itself can also contribute to symptoms of GERD and acid reflux. And if you start to have a lot of other signs that go along with the acid reflux, including diarrhea or constipation, bloating, and so forth, then SIBO may be something that we have to really look at. So to summarize, there's actually more to it than high stomach acid. I'm not saying that it'll never be high stomach acid, but if you understand how the body starts to work and how it functions, especially in sympathetic and parasympathetic tone, then we need to start working from there and understanding the behaviors and lifestyles and the many other factors that contribute to the optimal process of digestion. So this is why we consider diet and lifestyle changes first. Lifestyle being stress management and mindful eating, diaphragmatic breathing, etc. And that concludes our talk for today. Thank you so much for coming all the way and spending your time, your morning with me here on Monday morning. For those of you that, again, have yet to follow me or want to know more about what I do as a naturopathic physician or what I could provide for you in regards to your care, you can follow me and like me on Facebook, YouTube, and Instagram. All the recordings are provided through YouTube, and I will check that recording again in terms of IBS. My website at www.drromifungnd.com. And if you have any specific questions that we don't get through with our talks, that you're more than welcome to also contact me, also to email me at contact@drromifungnd.com.